HemoPill establishes Ovesco's first product line for telemetric diagnostics. Thanks to a quick and easy measurement, it enables the immediate detection of acute bleeding in the esophagus, stomach, and small intestine. The system consists of a small capsule with an optical sensor, the HemoPill Acute, which transmits measured values via radio to the portable HemoPill receiver. It is easy to use and does not require patient preparation, so that the capsule is immediately ready for use, even in an emergency. Since the HemoPill capsule is only about half the volume of conventional video capsules, it is easy to swallow. Using a photometric method, the capsule measures even small quantities of liquid blood or hemotin. The data transmission is secure and takes place in real time, allowing for immediate detection of acute bleeding. In case of gastric bleeding, blood can be detected within a few minutes after swallowing the capsule. A positive result indicates a prompt endoscopy and therapy, whereas a negative finding indicates postponement or avoidance of an emergency endoscopy. The maximum measurement duration is 9 hours. Thus, the upper and middle digestive tract can be examined for blood. Due to quick and easy measurement, the HemoPill Acute can be used in different areas such as endoscopy, emergency room, or intensive care unit. This allows quick prioritization of endoscopic procedures in daily clinical routine. Ovesco, innovation in scope.